Hi everyone, welcome to this channel, the NP Mentor. This is Daphne. I am a family nurse practitioner. Welcome to this live. So, quick disclaimer, this is a refresher designed to help you master the nursing content you already know. So, we usually have fun answering questions. So, this afternoon we'll be answering some nursing questions, mostly pharmacology questions. Let's start with question number one. We have a patient taking lisinopril. Which lab should you monitor for? Is it sodium, B potassium, C calcium, or D magnesium? What do we know about lisinopril? So this medication is an ACE inhibitor, okay? So you have to remember that they can cause hyperkalemia. So in this case, you will have to monitor the potassium level. So the correct answer is B. Next question. A patient receiving warfarin should avoid which food? Is it A, bananas, B, cheese, C, spinach, or D, chicken? What do you guys think? So the correct answer for this one is C, spinach, because vitamin K decreases warfarin effectiveness. So make sure you remember this. Next question here. A patient taking metformin should hold the medication before which procedure? So this medication is used for diabetes. So let's see here. The correct answer is B. So you need to hold metformin if the patient has a CT with contrast scheduled, okay? Because of the risk of lactic acidosis with contrast dye. So the correct answer is B. Next one. Which symptom in a patient taking digoxin requires immediate action? Is it A, headache, B, yellow vision, C, dry mouth, or D, insomnia? Correct answer for this is B. So if the patient starts reporting yellow vision, you need to start thinking about toxicity. So this is a classic dig toxicity sign, okay? Next one. A patient prescribed furosemide should be monitored for, is it A, hyperkalemia, B, hypokalemia, C, hypernatremia, or D, hypercalcemia? The correct answer for this one is, can you guys guess? Well, actually, I don't want you to guess. Do you know the answer? The correct answer is B, hypokalemia. Furosemide is a loop diuretic. Another name is Lasix, right? So the loop diuretics, they waste potassium. So you need to monitor for low potassium. Next question. A patient taking insulin lispro should receive the medication when? Is it an hour before meals, at bedtime, with meals, or immediately before eating? Okay, let's see what the correct answer is for this one. So we know insulin lispro is a rapid acting insulin, right? This type of insulin has a fast onset. So the correct answer is D. So they need to receive it immediately before eating. So make sure that the patient has their food in front of them and they're able to eat it as soon as possible after they receive it. Okay. Next question. Which instruction is priority for patient taking nitro? Is it A, B, C, or D? So this medication is given when a patient is having chest pain, right? So you can give that to them up to 3 pills. And if the pain is unresolved, then you need to make sure that the patient gets further care, right? Okay, so with this, you have to make sure that the patient sits before taking it. So the correct answer is B, sit before taking, because that will prevent orthostatic hypotension. And this is incorrect because this is a sublingual medication. So A is incorrect. they have to place it under their tongue. Okay, so next one. A patient taking prednisone long term is at risk for, is it A, hypoglycemia, B, weight loss, C, hyperglycemia, or D, bradycardia? Prednisone is a steroid. Okay, so what do steroids do to the blood sugar? It will increase it, right? So the correct answer for this is C, hyperglycemia. So B is incorrect because that will cause the opposite, weight gain instead of weight loss. Okay, so the correct answer is C, hyperglycemia. So steroids, they increase blood glucose. Next one. Which finding in a patient on heparin requires immediate intervention? Is it A, platelets 90,000, B, INO 2.0, C, hemoglobin 13, or D, heart rate 72? The correct answer for this is A. So you need to think about possible heparin-induced thrombocytopenia. And if you look at everything else, the INO is fine, 2.0, hemoglobin is okay, and heart rate is okay. The only thing that is not within normal range is A, right? Platelets 90,000. Okay, next question here. A patient taking levothyroxine should take it with food at bedtime, on an empty stomach, or after lunch. So this medication is for hypothyroidism, right? So you have to teach your patients to take this medication on an empty stomach. Usually this medication is given early in the morning, so make sure that they take it by itself on an empty stomach because that will improve absorption. So the correct answer is C. Next one. A patient receiving morphine should be monitored first for, is it constipation, respiratory depression, nausea, or itching? The correct answer is B, respiratory depression. This is a priority safety concern. Yes, those are side effects of morphine, constipation, nausea, itching, but you need to monitor for respiratory depression. This is the safe it is a safety concern. Next one. A patient on hydrochlorothiazide should increase intake of potassium rich foods, sodium rich foods, calcium supplements, or iron supplements. So the correct answer for this is A, potassium rich food, because thiazides, they cause potassium loss. Next question here. Which medication should a patient avoid while taking sildenafil? Another name is Viagra. Is it aspirin, metformin, nitro, or amoxicillin? So the correct answer for this is C, nitro, okay, because of the severe hypotension risk. Next one. A patient taking lithium should report A, increased thirst, B, hand tremors, C, weight gain, or D, metallic taste. The correct answer is B. So make sure that they report hand tremors because this is a sign of lithium toxicity. Next one, let's talk about albuterol. A patient prescribed albuterol should be taught it may cause bradycardia, sedation, tremors, or constipation. So for this one, the correct answer is C, tremors, because of the beta agonist side effect. Okay, so usually they'll have tachycardia instead of bradycardia and some tremors. Okay, the next one. A patient taking clopidogrel should avoid NSAIDs, antacids, vitamin C, or multivitamins. Okay, you need to remember that the NSAIDs, they increase bleeding risk, so they should avoid NSAIDs. Next one. A patient on vancomycin should be monitored for A, B, C, or D? The correct answer is A. So you have to remember that vancomycin affects ears. Ototoxicity. Okay. Next one. A patient taking spironolactone should avoid bananas, apples, rice, or bread. The correct answer is A, bananas, because it's high in potassium and this medication is a potassium sparing diuretic. Okay, next one. Which finding in a patient on metoprolol is expected? Tachycardia, increased blood pressure, bradycardia, or hyperthermia? Okay, metoprolol, the LOL medication, right? Beta blocker. So the correct answer is C, bradycardia. That's why you need to check the heart rate before you give a beta blocker because that can lower the heart rate. Okay. Next one. A patient taking rifampin should be taught urine may appear A blue, B red orange, C green, D clear. The correct answer is B red orange. This is a harmless side effect. So you need to let them know that they don't have to be alarmed. So that is an harmless side effect. So don't forget to subscribe to this channel, the NP Mentor, and I'll see you next time. Bye.